We often we treat our self-care routines like, I don't know, a monthly spa day, like an occasional treat to just hit the reset button.
Right, exactly. Just a rare indulgence.
Yeah, but, well, according to some recent clinical data on geriatric acupuncture, aging bodies actually don't need that rare indulgence. They require a pretty rigorous weekly strategy to maintain vitality. So, welcome to your custom deep dive. Today we're exploring why high-frequency intervention for seniors is like a vital health investment.
It's a huge paradigm shift,
It
honestly.
really is. So, okay, let's unpack this. Because if we look at physical therapy, you would never expect doing like one bicep curl a month to actually build muscle.
No, of course not. You need the reps.
Right, you need those weekly reps to force the body to adapt. So is that essentially what's happening here with acupuncture? Are we basically treating it like a monthly car wash when, aging bodies actually need a weekly oil change to keep the engine running?
That oil change analogy really gets to the core of it, yeah. Because to understand why we need these weekly reps, we have to look at how bodies basically lose their biological elasticity as they age. Like, a younger person might get a treatment and their nervous system just snaps back to a healthy, balanced baseline. But for an older adult with, chronic issues, the body tends to snap back to a baseline of pain.
Oh, I see. So if they wait too long between sessions, say stretching it out to once a month, they face what practitioners actually call the reset.
Right, the reset. And if they wait until their symptoms just fully return before going back to the clinic, well, the nervous system has already reverted to a state of chronic alarm.
Wow, so they lose all that cumulative momentum they built up.
Exactly. And ironically, spacing out the appointments means they actually end up needing more total visits over the course of the year.
Okay, wait, I have to challenge that premise a bit.
Yeah.
Because, the data is very clear that acupuncture does not cure structural degeneration, right? Like, if you have spinal stenosis or a severe loss of joint cartilage, that's a permanent physical reality.
Yeah, that doesn't just go away.
Exactly. So isn't a weekly visit just, I don't know, a very frequent, time-consuming Band-Aid for an unfixable structural problem?
Well, what's fascinating here is that we aren't talking about miraculously regrowing cartilage.
Okay.
We're talking about retraining the nervous system itself. You see, every time a needle is placed, it signals the brain to release endorphins, right? And it regulates stress hormones like cortisol.
Okay, I'm with you.
But if you wait a month, those chemicals just wear off,
No.
and the brain's pain loop fires right back up.
Oh, wow.
Yeah, but by striking the nervous system weekly, you keep the pain receptors bathed in those endorphins long enough that the nervous system actually, forgets its chronic state of alarm.
So instead of just automatically reverting to a chronically stressed state, the body is literally forced to learn a new normal.
Exactly. It's building that cumulative momentum we talked about.
That makes total sense. And, it's easy to talk about cortisol and endorphins in the abstract, but when you look at a real patient, like Sandra, the 79-year-old from our clinical sources, you can really see this neuroretraining happen in real time.
Yeah, her case is a perfect example.
Right, so she started weekly treatments back in, I think it was April 2023, specifically for stress-related shoulder pain.
And because she was in the clinic every single week, her practitioner wasn't just, endlessly chasing that shoulder pain. The high frequency actually allowed them to treat her entire system.
Oh, really?
Yeah, they caught and managed her low back pain, some seasonal allergies, her thyroid health, and even discomfort from a hernia, all before any of those issues really escalated.
See, here's where it gets really interesting, because by acting as this weekly diagnostic check, those minor imbalances were fixed before they became major system-wide breakdowns, like doing a diagnostic check on a classic car.
That's exactly it. And now she's highly active, she feels healthier overall.
But, is the mainstream medical community actually buying into this weekly frequency? Because, it sounds like a massive commitment to ask of a patient, both in terms of time and resources.
Oh, the medical community is paying very close attention to this.
Right.
Actually, there's a large-scale pragmatic trial happening right now. It's called Back in Action.
Oh, interesting. What exactly are they looking for with that?
Well, if we connect this to the bigger picture, they are specifically evaluating acupuncture dosing. So, meaning the frequency and duration of treatments for older adults with chronic low back pain.
I see. So they're trying to find the sweet spot.
Right. The goal is to generate hard data to inform Medicare coverage decisions. because Medicare wants to know exactly where that tipping point is.
Makes sense.
Because, if covering weekly sessions keeps a senior out of the emergency room, or prevents a devastating fall, or even reduces opioid prescriptions, then funding that weekly frequency, it transforms from a luxury into a massive strategic health investment.
Yeah, that completely flips the narrative. So what does this all mean for you listening? I mean, whether you are 65 or 25, Sandra's story really proves a vital point about proactive maintenance.
It really does.
Like, our bodies lose elasticity over time, and high-frequency, consistent interventions might actually be the only way to stop that minor daily wear and tear from snowballing into permanent health crises. Like we said earlier, you can't just do one bicep curl a month and expect your body to adapt.
You really can't. And, it makes you rethink the baseline we just accept for ourselves as we get older.
Oh, totally.
Because if weekly interventions can successfully retrain a 79-year-old's nervous system to just, step out of a state of chronic alarm, it really begs the question.
What's that?
What other so-called inevitable signs of aging in our own bodies are actually just cumulative, unregulated stress that we've simply stopped trying to manage?